Good morning, ladies and gentlemen, and welcome to the Portland School District Podcast. We're live here in the Town Tech Educational Podcast Studio at Portland High School, and this is going to be our episode number 19, and this is going to be the first one of the new year, and with us in the studio is our Superintendent of Schools, Dr. Charles Britton. So welcome, Charles.
Hello.
Happy New Year.
Happy New Year to you, too, and to everybody listening.
Yes, this is the calendar flipped over another page.
It sure did. They go by quicker.
Yes, they do. Yes, they do. So, what's new in the new year? I think we just got back to school yesterday, so I think everything is status quo. We're back in business, and so give us the update. What's going on?
Yeah. So, unfortunately, what's old is what's new, right? I mean,
Yes.
I think two years into a pandemic, certainly we were all hoping that at this point we would be at a different place, but
Right.
yeah, we're back. We're open. Everybody is here. I am guardedly optimistic, but certainly aware that we remain in some challenging times. And
Yes.
I want to spend some time with you this morning, and anybody listening to this to give the lay of the land and review some of the updates that we've received, and talk about our intentions, hopes, and aspirations going forward.
Yeah. I think like I say, things are a fluid situation, and certainly not only locally but nationally, and so I think everybody is just kind of coping and calling audibles when we need to.
Yes, indeed, no doubt. So, sometime soon, Dave, we will be doing these podcasts and not talking about COVID infection rates and quarantines and isolations and all those things.
That would be good.
Yeah, unfortunately, it is not today.
No.
Right? So, we are still very much in the thick of this.
Yeah.
So I did get from our Chatham Health District Director the latest numbers, and they're about as bad as they've ever been in terms of number of new infections.
Right.
They're very high in Portland and Chatham Health. I think they're almost as high as they've ever been, since the very beginning of this. And I will say that is very consistent with our experience in the week before we headed into winter break.
Yep.
We had more cases, positive cases reported to the schools during that week than ever before, right? We were very busy with contact tracing and communicating guidelines and recommending testing and doing some things. And, I think we heard before the winter break that we could expect another surge after the holidays, and I think we're living it right now. So,
Yeah.
I generally speaking, I think we have to assume that on any given day, if we're around large numbers of people, somebody within that group will be likely positive, right?
Yes.
I mean, whether they're symptomatic and positive or asymptomatic and positive, I think we just have to live our lives now assuming that the virus is here and it is very
Real.
present. Yeah.
Yes.
Omicron is omnipresent, right? So
For sure.
So with that said, if we think back to this time last year, before vaccinations were present, when we were looking at these same numbers,
Right.
About the same, really. We were remote, right, for
Yes.
that 4-week period of time from about Thanksgiving till about now.
Yep.
And the reason we were remote at that time is because nobody was vaccinated yet.
Right.
And anytime there was a close contact, people were being sent home for 10 days.
Yes.
And told to isolate and monitor for symptoms.
Mm-hmm.
And that wiped us out
Yes.
of administrators, faculty, staff, and students. We were quarantining enormous numbers of people. And of course, we just did not have a pool of substitute bus drivers and teachers and paraprofessionals and
Right.
secretaries and administrators to come in and help us, right? That's what shut us down. It wasn't anything related to safety. It was simply a matter of staffing our building.
Exactly.
Right. And during that 4-week period of time, I and other administrators, we worked very hard to recruit substitute teachers, and many of our parents came forward and said they were willing to help.
Mm-hmm.
That got us back open.
Sure.
And allowed us to stay fully open from about January 5th or so last year right through till today.
Right.
I'm here again to put the plea out
Yes.
that if any of our parents or anybody pretty much 18 and older at this point, if you're able or willing to substitute teach or volunteer, I would love to hear from you. My email address is on the website. Please give me an email or a call, and I'd love to talk to you about your ability to come in and help, because we're confronting the same thing again.
Yes.
Now, things are qualitatively different now because of vaccinations and changes to guidelines, but we are open. Our faculty, as of right now, is pretty well staffed. You know, I have about 7 paraprofessionals and teachers who are out with positive COVID cases. But you know, if the numbers stay where they are, I think we're going to have to watch that carefully.
Sure.
Right? There are several districts in the state now that are closed for these staffing reasons.
Right. Right.
I want to stay open, and but of course, we need adults in the building to supervise and maintain a continuum of instruction during the period of absence of our regularly assigned faculty and staff. So that's where we are.
Yep.
All right. Well, let me kind of run down what happened over literally New Year's Eve. Right?
Yes.
So, right at the end of our break, there was alarming numbers. I think 20% positivity rate in the state.
Yes, and I think that it's still above 20.
Yeah, I think with 21 I saw yesterday.
Yep.
And those are just, by the way, reports of the PCR tests that people are doing at the walk-up, drive-through Quest type.
Yep.
Those aren't even the in-home ones.
Exactly.
Right? And I think a lot of people were seeing those numbers and going, "Holy cow! Are we going to be remote again?"
Yeah.
That those numbers are. I have the number here in front of me. We have in Portland 67.8 per 100,000 cases. If you remember, right at the beginning of this, 15 was supposed to be the number where you were going to go remote. Now it's, probably closer to 90 per 100,000 today. But because this is a little bit dated information, but they're very, very high numbers. So we were told, of course, and it is always the governor that reserves the ability to send us into remote, that we would be reopening in person, and that we would be expected to stay open as long as we could continue to staff our buildings. And that if we couldn't staff our buildings and had to close, that the closure should be treated as snow days. Excuse me, not any remote learning.
Correct.
So that's what we're intending to do. Is stay open, and if we ever had to shut for staffing reasons, it would be short term, and it would be made up in June.
Yep.
And that's not always good. I hope that doesn't happen, because if we had some sick snow days, and snow days, we would be looking at about 10 days between the last day of school and the end of June, and then from there we'd have to consider April vacation, or canceling professional development days, and as much time as we could. So I'm certainly hoping that between Mother Nature's weather events, which I know we're getting one this Friday, I'm hearing, and the potential for, like what the town of Ansonia is experiencing now, which is a staffing crunch, and I know Hamden has had some issues this week too, that we don't go over, obviously, 15 days. Because then we would be looking at being here all the way to the end of June and possibly chipping away at some of our vacation days in April. So, I've lived that before.
We don't want to go there if you don't have to.
If you remember, I think it was 2012 with the hurricane and the freak October snowstorm.
Snowtober.
Snowtober, right. That's right. We were in school right until June 30th, and with no April vacation, and it was very hot, and people were very tired. And
that's...
That's...
Well, fortunately, I think so far winter has been been kind to us so far.
So far.
I
Yeah,
mean,
so
who
far.
would have thought we would have been experiencing 50-degree weather on New Year's Day? You know.
Yeah, we skiers are a little disappointed, but
Yes.
we'll get our runs in this year.
I'm sure. I'm sure. Yes.
All right. So over the weekend of New Year's Eve, we got some new guidelines from the state Department of Public Health that were based, I believe, on CDC changes that are, I believe, specifically designed to allow us to stay open, even when large numbers of people are testing positive. Right. The first big change was that the period of isolation, if you test positive, or quarantine, if you're unvaccinated and a close contact with somebody who tests positive, is reduced from 10 days to 5 days.
Yeah, that's huge.
That's huge. Right?
Yes.
So, and if you're fully vaccinated and a close contact, you don't have to quarantine at all, right? If you're positive, you would have had to isolate for 10 days.
Yep.
And that's a lot of time.
It is.
So reducing from 10 to 5 has certainly been helpful in terms of keeping schools open. And I think that, you saw, even you've seen that recently in airlines, and I understand Walmart had to close a couple of times because of staffing.
Sure.
And so, again, I'm not here to comment on whether infection periods or the science or the epidemiology of the pandemic is a function of 10 days or 5 days. What is quote unquote safer,
Right,
or less likely to spread a virus. But certainly from an ability to keep our community and our economy and our schools running,
right,
that reduction from 10 to 5 is
significant.
really very helpful.
Yeah, absolutely.
I have heard from folks questioning the wisdom of that from a mitigation point of view, and I have no comment on that. I mean, I don't have the ability or the training or the skills. I think that those are legitimate questions to ask virologists or epidemiologists. Certainly, from somebody who wants to keep folks in classrooms,
Sure.
It's helpful to go from 10 to 5 because that means that people can return to work quicker.
Yes.
Alrighty, so we're open fully. That has been, length of time has been reduced. And then the other significant change is that from now forward, our nurses and our administrators are no longer doing contact tracing.
Yeah.
That
That's time consuming.
Oh my goodness, Dave. So first, I have to give a shout out to our nurses and administrators, but our nurses in particular, for all the work they did over the past year and a half. I just have to describe it briefly, that whenever they got a report of a positive case, they then had to look back several days and do a comprehensive investigation to identify every person in every classroom, cafeteria, bus, sports team, every school-related environment that positive person was in touch with.
Right.
Communicate with every single one of those people.
Right.
And say, are you vaccinated? If the answer was yes, fully vaccinated, then it was monitor for symptoms, you were a close contact. If it was partially or unvaccinated, the directive was stay home for 10 days and monitor for symptoms.
Right.
I'm not exaggerating to say even a single positive case could take a nurse an entire day of looking at class lists and seating charts and interviews and discussions, and then of course the calls home to the parents and the upset parents who, oh my goodness, what
am I going to do?
Yeah, I mean, my daughter,
I got to go to work.
Quarantined several times. It's holy cow. It was exhausting.
Yeah.
And I think the recognition, and it's a reality.
It
is that there are going to be so many positive cases that it is unsustainable and untenable unless we hired 15 more nurses, or an army of contact tracers to do that anymore. So we've been told no more contact tracing. So the school will not be calling home ever again unless that changes,
Yeah.
to say you're a close contact. Are you fully vaccinated? Are you partially vaccinated? Are you unvaccinated?
Right.
And what to do.
Yeah.
So that's over.
Yeah. Right.
That's a huge change.
Yes.
Right. So, and I've shared the numbers with the community before. We have quarantined over the past 2 years many students.
Right.
Very few of whom tested positive because of
Sure.
an in-school contact, but hundreds and hundreds of students were sort of medically told they had to stay home, right? So that's the other, primary change is that
Right.
we're not, reduction from 10 to 5 days, and the no longer contact tracing, I think are going to help us stay open and have more students in attendance regularly from here on out. How could it not? Essentially is where we are.
Well, I think statistically, it's proven that kids are much safer in the school environment anyway.
Right.
From that standpoint, as far as from the infection rates. That's one stat that's on our side.
Yeah. And I will say, I can say this as a matter of fact, not speculation, that I am aware of I will put the number at 2 or 3
Yeah.
possible in-school transmissions ever in the
Okay.
Portland Public Schools. Small number,
Yeah.
and hundreds and hundreds of quarantines, right? So I believe it is accurate to say that we continue to not see in-school transmission. Now, whether Omicron is more transmissible and can get through the masks that I'm wearing right now and you're wearing is to be determined. But for right now, the evidence suggests that school's a relatively safe place to be.
Yes.
As opposed to a sleepover or
Doing yes.
other things
Exactly.
that we know have been, relatively more effective at spreading a virus. So that's where we are. Now, I just want to add one other thing. So over the past couple of days, several parents have reached out to me and said, look, I'm not feeling school safe, and I would like remote learning for my children, right? This has been another hard message that I've had to communicate,
Yes.
that at this time, we are not allowing remote learning. We don't have the PVLA, and we don't have remote learning for our students, except for some exceptions.
Right.
If a student is positive or required to quarantine because of a close contact and they're partially or unvaccinated,
Right.
then we do provide some synchronous access to the classroom, and our teachers communicate with students.
Okay.
If parents have a documented and unusual vulnerability in their home, then we would allow some synchronous access to the classroom. And that synchronous access would count as the student being present in school.
Okay.
And then, of course, in rare cases where a planning and placement team or 504 team determines that a remote placement is the best for the student, then we would allow it then.
Right.
But other reasons are not acceptable any longer.
Right.
And the big one is, of course, if parents are saying, I need to keep my child home out of an abundance of caution, that's an unexcused absence, and we don't provide a remote opportunity for that student. And I know that's disappointing, and some parents may feel that's not fair.
Right.
And I understand that. I empathize with that, but it's those are the expectations. Those are the
Well, and again, that's the ground rules that we're working under, and I think everybody has to make accommodations and make the decisions that feel they work for them.
Yep. So that's about all I have in terms of updates. I did send information out to the community. We have posted it up on the website. It's it's obviously been widely communicated in the press. Otherwise, the good news is we're here.
Yes.
Our students are here.
Yeah.
Our student attendance is a little higher than normal, but not terrible. We're We are fully staffed. We're running athletics and extracurricular activities, and we're going. And
Yeah, speaking of extracurricular and the activities, what's the mitigation strategies on winter sports?
yep. So the drama around winter sports was pretty significant right before the break.
Okay.
It was the position of the CIAC and the DPH that governs athletics, the CIAC, that for indoor athletics, with the exception of sports that would be unsafe, like wrestling,
Right.
that vaccinated students wouldn't have to wear a mask during competition.
Okay.
Like our basketball players, if they're vaccinated, wouldn't have to wear a mask. But unvaccinated athletes would.
Okay.
And you know that, how do I say that? That created a little uproar
Yeah, well,
on two grounds.
sure.
One was that, hey, wait a minute, there's a lot of COVID in the community. Is it safe for anybody to not be masked, vaccinated or unvaccinated?
Correct.
Is there a level of common sense in saying that, during activity that is highly aerobic and highly aerobic and likely to spread a virus, that everybody who's vaccinated or unvaccinated be unmasked, right?
Yeah.
And then the second concern, of course, was, well, doesn't this stigmatize
Your student.
unvaccinated students
Yes.
by, if they're the only ones wearing a mask, people would assume that they're
Unvaccinated.
Yeah, I mean, I don't know. I don't want to comment on whether stigmatizing unvaccinated people is an awful thing or
Right.
it may be.
Right.
And I also, ask the question: is it good common sense to take a mask off at all right now?
Right.
Right.
Well,
Whether
I think
you're vaccinated or unvaccinated.
I think some school systems have done that to where everybody's masked.
Yeah.
You know.
Right. So because of that uproar
Yeah.
that happened, the CIAC and DPH did change course and have now said everybody wears masks.
Yeah. Mm-hmm.
So, and I think that that was
Probably
the right move
for
for
the decision. Sure.
prudent, common sense decision.
Mm-hmm.
Certainly addresses the stigmatization issue.
Yep.
And at least until we're on the other side of this curve.
Yes.
It's pretty logical for that indoor activity.
Yeah.
Keep your mask on. Right.
Well, and I think on the other side too, from a standpoint, we've been in this for how long? Almost 2 years now. I think most students are used to wearing masks. So
I totally agree, Dave. That we just have to say to anybody that has concerns about our students and wearing masks.
Right.
Our kids have been amazing.
Yeah.
The concerns aren't coming from kids.
No.
Right. I mean, you don't see kids out.
These are the rules.
Unmask our kids signs on their lawns or anything.
Right.
Our kids get it.
Yeah.
And our kids are wonderful. This is largely all I've found been an adult issue.
Yeah.
But I think that yes, our kids have. This hasn't been easy on our kids,
No,
but
for sure.
they are really good young people. I'm really proud of them, and I think we all should be.
Yeah. Well, and it really hasn't been easy on anybody.
Right.
I mean, God, we've been all dealing with this and again, kind of changing course as we need to, and calling the audibles when we need to, and as the science changes, then we adapt.
That's right.
That's right. That's the nature of the beast, I guess, and it is a beast.
Yes, yeah, and I do want to also end on one other positive note. I think I would hope you would have Russ Melmid on, and
Yes.
he said something I thought was really interesting the other day, and I am hopeful that he's right.
Yes.
That he saw Omicron as, he called it a positive trinity, right? That Omicron could potentially travel quick, travel fast and far, and be really mild.
Yes.
Because if it got all of us and was really mild, it would push all the other nastier ones out of the way and help us build immunity for the next one that maybe isn't as mild.
And that's that herd immunity.
That's the herd immunity. I think that's what he was talking about. And I'm hoping that's what we're experiencing right now.
Well, hopefully, I'm working with now. I think Russ is going to be on tomorrow with Ryan, and because Ryan is going to be doing his podcast.
Good.
So, usually Russ calls in and chimes in and gives us the latest stats. So hopefully we can look forward to that.
Right. Right.
That'd be great.
Good. Well, look, it's all very complicated. It's happening fast. It can be very confusing and confounding. But I would just remind folks, pick up the phone, send an email to me, building principals, the nurses, and within our capacity, we'll explain things to you as best we can.
That's all we can do.
Yep.
That's all we can do. Anyway, all right. Charles, thank you so much. And again, this is our episode 19 of our Portland School District podcast. And again, Happy New Year to everybody out there. And, the other thing that I want to make mention, we had a very successcul handout of the COVID test kits on Sunday, and that went like clockwork. We had the CERT team up here, and a lot of the school custodians are members of the CERT team, and they did a yeoman's job, and it went like clockwork. And hopefully we'll be getting some more test kits and so forth. And again, after that kind of fiasco with the state where they had them, but they didn't have them, they didn't come in, and whatever. So we roughly, I think, Sunday handed out about 675 kits.
And masks, right?
And masks, yes, and masks. And just so everybody knows, if the N95 masks are available at the town hall in the first selectman's office, so if you want to go in and pick up a couple of masks, feel free to do so. And in the meantime, be prudent, wear your mask, make sure that if you're not vaccinated, get your vaccination, get your boost, and so forth, and we're going to get through this.
We will.
So, again, thank you, Charles.
Thank you.
Again, on behalf of all of us here at the Portland High School and the Portland School District, I'm your host, Dave Kuzminski, and this is our episode number 19. So stay home, stay safe, and wear your masks. Thank you.
Thanks.